Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Linzess. Linzess, also known as Linaclotide, is a new drug to treat two forms of constipation. There's the kind of constipation that's associated with the Irritable Bowel Syndrome, or IBS. And then there's what we know as chronic idiopathic constipation. Now, it's only for adults who are more than 18 years of age. It should definitely not be used in children less than 6 years of age, and it probably should be avoided in people between the ages of 6 and 18, and certainly for anybody who has an obstruction in the intestine. This drug should be taken at least half an hour before eating. If you take it immediately after you have a high-fat diet, chances are you get some diarrhea. You want to swallow the pill whole. You don't want to crush it or chew it. The dose for Irritable Bowel Syndrome associated constipation is 290 micrograms once a day, and if you have chronic idiopathic constipation, in other words, constipation without the pain, then the dose is only 145 micrograms a day. And interestingly, in January 26, 2017, a 72 microgram dose was allowed to be marketed by the FDA. Now, the drug stays in the gastrointestinal tract. It's a simple chemical, and it's inactivated by loss of an amino acid. It's only negligibly absorbed, so little is absorbed actually that you can't even measure it in the blood. So that means if you have liver disease, kidney disease, that's not really a problem with this kind of drug. It was approved by the Food and Drug Administration originally in 2012. Now, it's a simple chain of amino acids. Amino acids, the building blocks of protein, things like lysine and arginine, those are amino acids. Well, this contains 14 amino acids in a chain. 6 of the amino acids happen to be cysteine, and it has 3 what we call disulfide bonds. The way the drug works is it's a structural analog. It's similar to a chemical, a hormone that the body produces inside the intestine, and it latches onto a receptor, kind of like a lock and a key. And when that happens, a chemical known as cyclic GMP is manufactured, and that causes the bowel to secrete some chloride and some bicarbonate and then some water into the intestine. And that obviously is going to allow much greater ease of passage. It also decreases the activity of some sensory neurons, so that means it's associated with decreased intestinal pain, and it activates the motor neurons in the colon, so that means that all this extra fluid is going to get pushed out of the body. Now, it has some side effects, and about 1 in 5 people who take Linzess are going to suffer from diarrhea, and about 2%, or 1 in 10, of the people with diarrhea are going to have real severe diarrhea, and it's often going to occur in the first 2 weeks of taking the drug, and it can be very serious in pediatric patients, so that's why it's not for people less than age 6 and should be avoided 6 to 18 years of age as well. If you do have the severe diarrhea, you may develop low blood pressure and some dizziness, some fainting or syncope as we call it, low sodium and potassium, and maybe it's even going to require hospitalization and intravenous fluids. Well, it also is associated with some gas and some abdominal pain and feeling of fullness or distension. And in a small percentage of people, there will be some urge to defecate. In other words, you got to go and you got to go now, but sometimes you don't make it, and then you have fecal incontinence. Some people with vomiting or gastroesophageal reflux disease, rarely intestinal bleeding, or it can provoke some rectal hemorrhage. The studies that were done looked at people generally between the ages of 40 and 50. 90% of the people were women, 70 to 80% were white. For entry into the study, you had to have fewer than 3 bowel movements on average a week, and a pain score on a scale of 0 to 10 had to be at least 3, at least for the Irritable Bowel Syndrome portion of the study. Responders had to improve for at least 9 of the 12 weeks they were taking the drug. And by a responder, we mean the pain had to decrease more than 30% in severity, and you had to have at least 3 complete spontaneous bowel movements a week. Now, a complete spontaneous bowel movement is you completely get rid of all of the stool that's in your colon. You don't feel like you have to still go. And also, you had to have at least one extra complete spontaneous bowel movement per week. So that's not asking very much. But if we look at the response rate after 12 weeks, what do you think the response rate was? Taking this drug, taking Linzess, the response rate was only 12%, or 1 person in 8 got better. If you look at the pain only, well, about 35% of the people improved at least 3 points on the scale. But about the same number did taking a placebo. And if you look at the other endpoint, a complete spontaneous bowel movement, 80% of the people who took the drug failed. Only 20% of the people had an extra bowel movement a week. Well, that's certainly not very much. Now, if instead of looking at 9 of the 12 weeks, let's look at 6 of the 12 weeks. Are we doing any better? No, not really. Still 70% of the people fail to make the grade. Well, that means that we have to treat 7 or 8 people, or even more, in order to get 1 person who is going to respond. Now, if the abdominal pain does respond, it's going to respond within the first week, sort of maxes out at about 6 to 9 weeks. But remember, improvement is only about 1 point on an 11-point scale. Now, there is some improvement in the spontaneous bowel movement frequency, the stool consistency, and the amount of straining or abdominal bloating or discomfort. But if we look at people taking that 290 microgram dose for a period of 18 months, we find that about 1 in 3, 30%, are going to either have to discontinue the drug because of side effects or reduce the dose because of side effects. Now, on the other hand, if we look at the chronic idiopathic constipation, so it's sort of like the IBS with constipation, but it's without the pain. Well, according to criteria, you have to have fewer than 3 spontaneous bowel movements a week and at least 1 extra symptom for 12 weeks during the course of a year. But that doesn't have to be necessarily consecutive weeks. And the symptoms, the other symptoms that you have to choose from, are at least 25% of the time when you have a bowel movement, you have to either strain, or you pass lumpy or hard stools, or you have the sense of incomplete evacuation. Well, if by response, according to the studies, we have to show at least 3 complete spontaneous bowel movements a week, an increase of 1, and as a matter of fact, the 290 microgram dose and the 145 microgram dose work exactly the same. But the improvement in one study was 20%, the other study was 15%. In other words, somewhere between 80 and 85% of the people can't get better with this therapy. Well, if you do increase your spontaneous bowel movements, you increase them by about 1.5 a week, so that isn't all that much. Now, IBS, or Irritable Bowel Syndrome, also goes by the name irritable bowel, irritable colon, spastic colitis. It's abdominal pain and hard or lumpy stools at least 25% of the time. Estimated 10 to 20% of the population here in the United States suffers from that, and it means that about 10 million people have IBS with constipation. So, what do we know about IBS with constipation? Not all that much. It affects women twice as much as men. It's often associated with anxiety or depression, but we don't think that it's cause and effect. Some people think that maybe there's some low-grade inflammation going on in the intestine, or maybe some genetic factors, or maybe it comes on after some other kind of infection. Or maybe it has to do with a small bowel bacterial overgrowth, or maybe certain kind of diets. And then we have chronic idiopathic constipation. That's a gigantic problem. So there may be as many as 35 million people suffering from chronic idiopathic constipation here in the United States. And some people suggest the number might be 40, 50, or even 60 million, 14 or 15% minimum of the population. That means for at least 3 months, you've had fewer than 3 bowel movements a week. And you also have the hard or lumpy stools, the recurrent straining, and the sense of incomplete evacuation. And again, the therapy works, but it doesn't work all that well. Now, there are other options. Other options, you don't have to take a pill. You can go the dietary approach. So the dietary approach is you can increase the fiber-rich foods. You can have more fruit and vegetables and nuts and whole grains, increase the amount of fluid, go get some exercise, take some fiber, some psyllium. You can go the complementary and alternative medical route. You can go with yoga or acupuncture or hypnotherapy or biofeedback or behavioral therapy. And then there are some peppermint oil capsules. Now, it has to be encapsulated so it doesn't irritate your stomach. So enteric coating. And it can decrease the pain from the IBS, acts as something to cut down on the spasm, not necessarily to help you go to the bathroom more often. There are laxatives that work. We know you can take a stimulant laxative, something like Senna, which would be X-Lax or Senocot or Biscotal. That's Correctal or Ducalex. They can possibly cause some cramps and maybe some diarrhea, and maybe they lose some effect over a longer period of time. But we have another one, and it's known as polyethylene glycol, marketed as Miralax. You can take a whole month of that for what it would cost you for 1 day worth of the Linzess. There are other therapies. You can take an anti-spasm kind of medicine. That would be medicine like Levsin or Bentyl. They work to relax the smooth muscle, but they might cause some side effects. They might actually make the diarrhea somewhat worse. We have prokinetics that move things along in the intestine, like Amitesia. That was approved in 2006. It works on the serotonin pathway. It seems to activate some of the chloride channels that increase the water secretion, but it doesn't work very well either. It only works about 18% of the time. So in other words, 80% of the people taking the drug don't seem to get better. But again, it hasn't been studied against any comparative therapy. But interestingly, we have Synergy Pharmaceuticals. Now, on January 19th, of 2017, so very recently, the Food and Drug Administration approved their drug known as Trulance or Placanatide. And that's going to be supposedly associated with less diarrhea. With Linzess might be 16 or 20%, but here with the Trulance, maybe only 5%. And severe diarrhea is going to occur 50 or 75% less frequently than with the Linzess. You can take it with or without food. Remember, you have to take Linzess half an hour at least before you eat. The discontinuation rate with Trulance is much less. The label is pretty much the same, but it doesn't mention pain because it's only approved at the present time for chronic idiopathic constipation. So just for people who have fewer than 3 bowel movements a week. Probably in later 2017 or early 2018, it's going to request approval from the Food and Drug Administration for IBS associated with constipation. Then it'll mention pain. So there's a word of caution in all of this. There was a drug known as Zelnorm. It was very popular, and it was a drug for IBS with constipation that was approved in 2002 and stayed on the market until 2007. In 2007, it was taken off the market. Why? Because the FDA finally realized, because of reports, that it was associated with heart attacks and stroke. So you do have to be careful about some of these new medicines. Now, Allergan has had, that's the manufacturer of the drug, has had several rounds of ads for Linzess. And it's taken about 10% of the people who are using simple, cheap, over-the-counter drugs and substituted the Linzess for that. And that's reasonable because they have 1,500 drug reps who go visit the primary care doctors, the gastroenterologists, the long-term care facilities. Sales of the drug in 2015 were up 50+% to about 450 million. In 2016, they were up similar amount for sales of about $650 million, and by 2020, they expect sales of this drug to be in excess of $1 billion, and it's spreading worldwide. Allergan owns at least 50% of a drug company called Ironwood. Ironwood has a patent on this drug. They're partnering with Allergan here in the United States and in the European Union. They're partnering with another drug company known as Astellas. Over in Japan, they're going to have a 500 microgram tablet over there. And they're partnering with AstraZeneca, another drug company, for sales in Hong Kong and Macau and in China. Well, the German government, they evaluated this drug, and they said, you know, there's no comparative evidence of how this drug works compared to any other drug. It's only compared against an inactive placebo. Patients who were studied didn't change their diet, they didn't change their lifestyle, they didn't get any more exercise. Therefore, they don't have any evidence of added benefit of taking this drug. But the company says, hey, we have a copay card. And the copay card means that you can pay as little as $30 a month, but not if you're a cash-paying patient, and not if you're a Medicare patient, a Medicaid patient, a TRICARE patient, or if you're receiving any other state or federal assistance. Well, what's the cost? The cost is the same for the 145 microgram or the 290 microgram pill. It's about $400 a month, or almost $15 a day. And that's for a pill that doesn't seem to work very well. So in summary, if we look at people who have irritable bowel syndrome associated with constipation or chronic idiopathic constipation, just the usual kind of constipation, it's unknown cause. The treatment should always begin with dietary modification, add some fiber, get some exercise, maybe take a laxative, go through some other lifestyle changes. And the bottom line is that Linzess doesn't work very well at all. 70 or 75 or 80% of the people do not receive significant improvement on a drug that costs $15 a day, but it's slickly marketed to a gullible public and to a medical profession that doesn't really look to see what the indications are and what the improvement is. And when we look at the final results of this drug, we find that, unfortunately, it just doesn't work very well. Anyway, I'm Dr. Ken Landau, and I thank you for watching.